If it doesn't hurt, it's not serious. A painless bite can be one of the most dangerous scenarios. Some neurotoxic venoms cause almost no immediate burning or swelling. Victims may assume it was an insect and ignore it. Meanwhile, toxins silently block communication between nerves and muscles. Early signs like drooping eyelids, blurred vision, or weakness may appear gradually. Within hours, breathing muscles can fail. The absence of pain does not equal safety. Neurotoxins work quietly, shutting down vital systems without dramatic warning. Waiting for severe pain before seeking help can drastically reduce the chance of survival. Bigger means deadlier. It feels logical that a large snake is more dangerous than a small one. In reality, venom potency is not determined by body length. Smaller species can carry highly concentrated toxins capable of causing paralysis, clotting disorders, or organ failure. A short snake can still deliver a medically significant dose. Judging danger by size leads to hesitation and careless behavior. Venom composition and the amount injected matter far more than visual intimidation. Underestimating a smaller snake can be just as dangerous as overreacting to a larger one. The baby snake myth, the idea that baby snakes are more dangerous because they can't control their venom, spreads widely. Adults, however, possess larger venom glands and typically inject greater total volume. Severe outcomes depend on dose, bite location, and speed of treatment. Adult snakes are responsible for most life-threatening envenomations. Focusing only on juveniles distracts from the real risk. Age alone does not determine severity. Believing babies are automatically deadlier can cause people to approach adult snakes with false confidence, and that miscalculation increases danger. Cut and suck saves lives. Cutting the wound or attempting to suck out venom has little medical benefit. Once venom enters tissue, it begins spreading rapidly through the lymphatic system. Cutting increases bleeding and infection risk. Suction devices remove negligible amounts. Time spent attempting extraction delays proper medical care. Effective response focuses on remaining calm, minimizing movement, and seeking treatment immediately. Survival myths may feel proactive, but they often worsen outcomes. In snakebite emergencies, wasted minutes can mean increased systemic spread and more severe complications. The warning illusion. Many expect a visible warning before a strike, a rattle, a hood display, or dramatic defensive posture. In reality, some venomous snakes strike quickly with little display. Waiting for a signal reduces reaction time. Certain fast species can deliver multiple strikes within seconds. Their venom may lead to progressive paralysis or internal damage if untreated. Assuming that nature always announces danger creates hesitation. In close encounters, even a brief pause can significantly increase exposure risk. Predictability is not guaranteed in wildlife interactions. If you can walk, you're fine. After some bites, victims may initially feel stable. They can walk, speak, and show few symptoms. However, certain venoms act progressively. Blood clotting systems may begin to fail. Muscle tissue can break down. Paralysis can develop hours later. Movement can accelerate venom distribution through circulation. Early stability is not proof of safety. Symptoms may escalate suddenly after a quiet phase. Immediate medical assessment is critical, even if the bite seems mild. Waiting for dramatic signs reduces the window for effective treatment. The dry bite assumption. Some bites inject little or no venom, but assuming safety without medical evaluation is risky. Symptoms can be delayed depending on species and dose. Early absence of swelling or pain does not confirm a harmless bite. Systemic effects may appear hours later. Only proper observation and medical assessment can determine severity. Believing a bite was dry simply because symptoms are mild can lead to delayed intervention. Monitoring is essential after any suspected venomous bite, regardless of how minor it initially appears. Tourniquets stop venom. Applying a tight tourniquet is often believed to block venom spread. In reality, complete blood flow restriction can cause severe tissue damage and increase amputation risk. Venom frequently spreads through lymphatic pathways, meaning full circulation blockage is ineffective. Improper use can concentrate toxins in one area, worsening local injury. Modern first aid emphasizes immobilization rather than cutting off blood supply. Slowing movement is safer than stopping circulation. Using aggressive tourniquets without medical training can create complications beyond the venom itself. Most snake bites are fatal anyway. Believing death is inevitable leads to dangerous delay. While snakebite is a serious emergency, Many cases are survivable with timely medical care. Antivenom and supportive treatments significantly reduce mortality. Death often results from late hospital arrival, ineffective remedies, or resignation. Panic and hopelessness slow decision-making. Survival depends heavily on rapid intervention. Assuming the outcome cannot be changed discourages immediate action. In many cases, the difference between life and death is not venom potency, but how quickly proper treatment begins. Venom spreads instantly through blood. Many believe venom immediately floods the bloodstream at full speed. In reality, most snake venoms initially spread through the lymphatic system, which moves more slowly than blood circulation. Panic and excessive movement can accelerate this spread. Running, struggling, or elevating the heart rate increases distribution throughout the body. The myth creates unnecessary fear and chaotic reactions that worsen the situation. Remaining calm and limiting movement can significantly slow systemic absorption. Understanding how venom travels helps prevent actions that unintentionally increase severity. You can identify danger by head shape. A common rule claims that triangular heads mean venomous and round heads mean harmless. While some venomous snakes do have broader heads, many harmless species can flatten their heads when threatened, mimicking that shape. Conversely, some highly venomous snakes do not fit the stereotype. Relying on visual shortcuts instead of knowledge of local species can lead to deadly misjudgment. Head shape alone is not a reliable identification tool. Assumptions based on appearance increase the chance of dangerous encounters and handling mistakes. Alcohol or herbal remedies neutralize venom. In some regions, alcohol, plant extracts, or traditional mixtures are believed to counteract venom. There is no scientific evidence that drinking alcohol or applying herbal pastes neutralizes injected toxins. Alcohol can worsen dehydration and impair judgment, delaying medical care. Topical substances do not remove venom already in tissue. These practices create false reassurance while venom continues affecting the body. Effective treatment requires professional medical intervention and, when indicated, antivenom. Substituting folklore for evidence-based care increases the risk of severe complications or death. Ice or electric shock neutralizes venom. Applying ice packs or using electric shock devices is sometimes believed to kill venom. Ice can worsen tissue damage by restricting blood flow and increasing local injury. Electric shock has no proven medical benefit and can cause burns or cardiac complications. Neither method neutralizes venom already in the body. These actions create a false sense of control while delaying proper treatment. Evidence-based first aid focuses on calm immobilization and urgent medical evaluation. Improvised techniques often add harm without reducing venom effects.